Hello, I'm Cara Rodriguez, a PhD student in the Applied Cognitive Ergonomics Lab from the Department of Industrial and Systems Engineering at Texas A&M University. This presentation will provide an overview of mobile health apps for post-traumatic stress disorder. Post-traumatic stress disorder, or PTSD, has four main symptom clusters, including intrusive thoughts, such as nightmares or flashbacks, avoiding thoughts or feelings that remind people of their trauma, negative alterations to cognition and mood, and changes in arousal activity, for instance, sleep deprivation or hyperarousal. Treatment for PTSD exists, and usually consists of pharmacotherapy or psychotherapy or a combination of both. However, some challenges prevent people from accessing mental health care. For example, geographically, people may be located far away from a mental health clinic. Temporal refers to the time required to attend the appointments. People may also experience financial difficulties. Culturally, many people still feel a stigma associated with receiving mental health treatment. And there are also some technological factors. A possible solution is the introduction of mobile health, or mHealth apps. These apps operate on a smartphone and improve access to healthcare by bridging some of the barriers previously discussed. Some of these apps are standalone, meaning they do not require the interaction between a patient and a clinician. One of the main advantages of using smartphones is that they are discrete and can be used to monitor and manage symptoms. We found limited knowledge on the current apps and the steps that led to their development, which guided our research objectives. We wanted to inform the design of a PTSD tool based on a systematic web search and a scoping literature review, as well as to provide a summary of the current mHealth PTSD apps. Our methods include a review of public PTSD mobile apps to investigate their availability, followed by a scoping literature review to investigate how the current apps are being used and their validation. The mHealth App Search spanned mobile app websites, commercial app stores, and a web search. The inclusion criteria consisted of the app being relevant for PTSD, PTSD treatment, or PTSD symptoms. Treatment apps for veteran support must be specific to US military or US veterans, and the app must be used without a web browser. 128 apps were found. These were further divided into 7 clusters, and they were also divided according to their utility. The scoping literature review was performed using the keywords post-traumatic stress disorder or PTSD and mobile applications or mHealth. Several databases were searched, and only journals published after 2011 written in the English language were considered. The inclusion criteria consisted of journals that reviewed or validated existing PTSD apps, provided detailed development of a new app, or presented a case study. A total of 8,850 articles were found, which were reduced to 28 after the inclusion criteria. Out of the 28, only 6 studies were focused on the analysis of an app, including 3 for prolonged exposure or PE coach and 3 for PTSD coach. In conclusion, this dual review of PTSD-related mHealth apps and scoping literature review highlights the available PTSD mHealth apps. While several mHealth apps were found, the review suggests that there is insufficient evidence on the app validation and a lack of user-centered procedures during app development. Recent advances in wearable sensors, such as heart rate monitors, provide an opportunity for future apps to integrate physiological changes as indicators of PTSD. More information can be found on the Post-Traumatic Stress Disorder and Mobile Health, App Investigation and Scoping Literature Review journal article.